Hi, my name's Kayleen. I'm a registered nurse studying to specialize in the field of perinatal nursing. I'm currently attending BCIT online, and as part of my breastfeeding experience theory course, NSPN 7155, I'm making this video presentation. This video is intended for nurses who are involved with breastfeeding care. I'll be discussing the combination of mastitis and Down syndrome and how these mother and infant challenges affect breastfeeding, and how you, as the nurse, can educate and support the dyad in overcoming these challenges, resulting in successful and continued breastfeeding. 3 priorities we have as nurses in supporting a mother with mastitis and her infant with Down syndrome are to resolve the mastitis, ensure an adequate latch with effective feeding from the infant, and appropriate infant weight gain and growth. This information is going to be presented and organized using Gillespie and Patterson's Situated Clinical Decision-Making Framework. This framework is recognized by CR and BC to assist nurses in a structured way of decision-making. This is the framework. It starts with knowledge, moves to cues, goes to judgment, decisions, and evaluation of outcomes. The framework first addresses knowledge in 4 components: knowing the self, knowing the case, knowing the client, and knowing the person. In addition to understanding the facts, it's important to consider the knowledge, skills, and limitations of both yourself and your client when teaching. Next in the framework is cues. This is where you make your observations and note any lab and assessment data. It then moves on to judgment. This is where you put your thinking cap on. After you've gathered all of your knowledge, cues, and judgments, you can start making decisions on what you're going to do. And finally, you evaluate your outcomes. Now let's put the framework to use. First of all, what is mastitis? Mastitis is inflammation or an infection in usually only one breast. However, occasionally it can be in both. If both breasts are affected, the woman must seek further medical attention as she'll need to be started on IV antibiotics. Mastitis is most common in the first 3 to 6 months postpartum, but can develop at any time. It's caused by infection, most commonly from bacteria entering the breast through the nipple, such as in cases of cracked nipples. It can also be caused by a blocked milk duct, in which milk sits and stagnates and can breed, thus further causing milk stasis. Now, what is Down syndrome? Down syndrome is a genetic condition in which not 2, but 3 of the 21st chromosomes are copied. This is also called trisomy 21. Infants with Down syndrome can have similar characteristics, some of which can affect breastfeeding. These include a protruding tongue, low muscle tone in their lips, tongue, and neck, and they tend to be sleepier than other babies. Newborns with Down syndrome are also at a higher risk of developing health conditions such as gastrointestinal and respiratory illnesses, and they are more susceptible to infection. So this is why breast milk is that much more beneficial to these babies. Moving on to cues. The signs and symptoms of mastitis are a painful area on the affected breast, which may have red or red streaks. It may be swollen and or hot to the touch. The woman may also have flu-like symptoms, such as fever, fatigue, malaise, chills, and body aches. And depending on the cause, she may also have cracked and sore nipples or breast fullness. So these are some examples of mastitis. Infants with Down syndrome may have difficulty latching to the breast, staying on the breast, and have a weak suck. In addition, these infants may fail to gain weight. have an insufficient amount of wet and dirty diapers, and have signs of dehydration such as poor skin turgor, sunken fontanelles, and decreased alertness. This is a picture of an infant with a protruding tongue. It is important to observe a feeding between mom and babe in its entirety to assess the latch, the feeding effectiveness, the length of the feed, the satisfaction post-feed for both mom and babe, and to assess the overall feeding relationship. Putting our observations and knowledge together, we can make some judgments. The infant's poor latch and fatigue could result in both cracked nipples and the breast not emptying fully, and therefore the milk stasis. Either of these could be the cause of the mother's mastitis. If the breasts are not emptying, the infant's poor growth could be from less milk transfer as a whole, but also from not receiving the high fat content in the hind milk. Many women stop breastfeeding due to the fear of pain or of mastitis or the challenge of breastfeeding an infant with Down syndrome. As nurses, we can correct this and empower these moms, enabling them to breastfeed successfully. It's important for moms to know that they can and should breastfeed when they have mastitis, as it can help resolve their symptoms. And the physical process of breastfeeding strengthens the infant's oral and facial muscles. And as part of knowing your own limitations as a nurse, it is important to know when the mother and babe could benefit from additional support from another healthcare professional, such as a lactation consultant or breastfeeding clinic. Putting everything we know about the situation together, we will make some decisions on how we can help mothers with mastitis feed their Down syndrome infants effectively. As with all scenarios, it is essential to remember the 3 rules. Feed the infant, move the milk, and help the dyad learn to breastfeed. Be sensitive and encourage the mother to be kind to herself. Remind the mother that her and babe can be successful at breastfeeding and that both of them are learning together. Actions the woman can take to resolve the mastitis are to get more rest, drink more fluids, apply warm or cold compresses to the affected breast, gently massage the breast prior to a feed, take Tylenol and or Advil to control the pain and fever, and if prescribed by her doctor, antibiotics may be needed. How can we help the infant feed effectively? Fully awake babe prior to feeding. Provide stimulation to keep the babe alert. Gently compressing the breast during feeds can help to keep the infant at the breast and nursing. And due to the infant's low muscle tone, a more supportive nursing position may be beneficial to an effective latch and feeding, such as with the dancer position, which supports the infant's jaw and chin, as seen here. As you can see, the woman is holding the chin in a U shape, and that is supporting the jaw. As well, the Lillichet League of Canada has created a pamphlet specific to breastfeeding an infant with Down syndrome. You may find this useful giving to your clients, as it aids in the mother having something hands-on that she can refer to when you're not available, or that she can look at when she's not as overwhelmed. Finally, let's evaluate the outcomes. Has the mastitis resolved? Is the infant feeding more effectively? And is the infant gaining weight and growing adequately? Is the mother satisfied with her breastfeeding experience? If any of your desired outcomes aren't manifested, you may need to re-examine your information or decisions and provide more support to your clients. As we discussed earlier, there are 3 priorities we have as nurses in supporting a mother with mastitis and her infant with Down syndrome. And they are to resolve the mastitis, ensure an adequate latch with effective feeding from the infant, and an appropriate infant weight gain and growth. I hope you enjoyed my presentation and are now confident in empowering your clients in successful breastfeeding. Thank you for watching.